In this video, we are going to discuss about catheter removal. You may or may not use a dressing set in this procedure. As per new recommendations, there is no need to clean the catheter site and you can verbalize that site is clean. You have to remove the same amount of sterile water inflated in the bladder as mentioned in the scenario. You need to verbalize that. Moving on to the procedure, first thing is scene safety. Then you need to perform a hand rub using the 7 steps of hand hygiene. Then you need to introduce yourself as an attending nurse. Then you need to identify the patient using 3 checks, that is name, date of birth and hospital number. Then you need to ask for any pain, any allergy and the need to use toilet. Then you need to provide privacy to the patient by closing the curtains and the doors. Then you need to explain the procedure of catheter removal, and you should also address the need for chaperone if the patient is of opposite gender. After this, you can move from the patient side after gaining consent from the patient. You need to do hand washing using 7 steps in wash basin provided. After drying your hands, you need to put on an apron and a gloves. Before cleaning the trolley, ask the examiner whether trolley is cleaned with soap and water in past 24 hours. You need to clean the trolley for 30 seconds and allow it to dry for another 30 seconds. You need to assemble the articles on the bottom shelf. The articles required are a 10 ml syringe, an alcohol wipe, a kidney tray, a dressing set, even though not mandatory, an incontinence pad, a sterile gauze. Then you need to bring the trolley near the patient by holding only the bottom part of the trolley and put on a gloves, expose the site, provide privacy, verbalize that site is clean and no need to clean again. Put IncoPad down, then put the kidney tray in between the legs. Tell patient about possible discomfort while removing catheter. For females, they will have a stinging sensation and discomfort while removing the catheter, whereas the males will have a slight discomfort when the catheter is being removed because of the prostatic urethra. Or you need to tell the patient to take a deep breath and exhale slowly while removing the catheter, as this will relax the pelvic muscles. Wipe the pot with alcohol swab for 30 seconds and wait for another 30 seconds to let it dry. Remove 10 ml of sterile water, or as mentioned in the scenario, remove the catheter after telling the patient. State about the condition of the catheter, that is, there is no kinks and encrustation at the tip of the catheter. If there is an encrustation or any kinks, you need to send the tip of the catheter for culture. Discard the catheter as soon as you removed with your gloves and the clinical waste bin provided. Then perform a hand rub, put on a gloves, dry the genitalia with the sterile gauze starting from urethra. Remove the IncoPad as well as kidney tray, put back the linen and tell the patient that procedure is over. Remove gloves, do a hand rub. After removing catheter, you need to educate the patient, that is to report any increase in frequency or urgency, burning sensation while urination or any incontinence. Tell the patient to collect the next urine in a pot so that you can measure the output of the patient. You need to also mention about drinking water and exercise. Educate the patient about need for drinking 2 to 3 liters of water to flush out any bacteria present and to exercise to strengthen the sphincter function. Give call bell to the patient to report in case of any adverse reaction or problems. Put on a clean gloves and discard used items in the clinical waste. Perform a hand wash at the wash basin using 7 steps of hand hygiene. Document that urinary catheter is removed and there was no kink or encrustation in the tip. Do a hand rub and leave the room. Please don't forget to like and subscribe to our YouTube channel for further videos. Our YouTube channel is named as OSCE for NMC Part 2 training videos.